Your smile could be making you look much older than you really are. Well, today I'm gonna discuss this very important topic. And before I keep going, make sure you like, share, and subscribe to our channel today. And put code DENT87, DENT 87 to get a virtual complimentary consultation for teeth whitening or dental implants, or even just come over to our dental office for complimentary consultation too. We are based in Princeton, New Jersey, and today I am your host. I'm Dr. Radwa Saad, the host of the Wonder Tooth podcast. And a little bit about myself: I've been practicing dentistry for over 20 years. I have a license in the United States as well as in Canada, and I have a master's degree in implant surgery and implant restoration. I'm a digital dentist, so I do a lot of digital dentistry in my office. We're very high tech, like pretty much 1% nationwide high tech, because it's an incredible service for our patients. And today we are going to discuss how your smile can make you feel or look a little bit older than what you really are. Okay, old is always like a big taboo, but here we are. So let's talk about symmetry in the face. And if you are younger or a youthful face, basically, you have more plump face. You have the lips are a little bit bigger or kind of plump. Your teeth are whiter, and you have symmetry in your face, and basically your gums are healthy. Now, when we grow a little bit older, things starts to change, at least in the teeth and the lips and the lower jaw. And by that I mean, when you grow a little bit older, your teeth starts to become a little darker, and that's normal because of years and years of function and drinking coffee, drinking tea, even soy sauce can make your teeth a little bit darker too, smoking, so they start to become a little darker. And also from years of function and grinding, they start to become a little shorter. And when the teeth starts to become a little shorter, then this is when you're basically the 1/3 of your lower jaw start to change shape. And basically you start to see a little bit of wrinkles around your lips, and that's because your teeth are getting a little shorter. And what else? Your face starts to sink in. Like here, your cheeks start to sink in. We call it like a collapsed bite. And all of this because of years of functioning and wearing your teeth out. So let's think of your smile or your teeth. It's basically the frame of your face. It's the frame. So if your frame is a little bit crooked, your whole face is gonna look, the painting is gonna look different. Like you see the painting behind me here. So if that frame is like this, you're gonna look at it and you're gonna think something looks off. And that's basically with the teeth as well. So if the teeth, they look like misproportioned or malaligned or something, and or like the color is one tooth different color than the other, something looks off. So what are the signs? What are like the biggest signs of, or basically the factors that can contribute to you look a little bit older? Well, of course, the discoloration or yellowing of the teeth. And discoloration and yellowing, that happens over a period of time. It could also sometimes happen from certain medications you are taking, or coffee, tea, as I said, smoking, certain diets, certain food. All of this can cause yellowing and discoloration. But not only that, but sometimes you can start to see little crazed lines in the teeth, and this is from years of functioning. If you look in the mirror, you can see very thin lines, and they get discolored too. And you look at your teeth and you're like, my tooth used to be white and now I see like little lines and they look a little darker. These are crazed lines, and this happens with age and time. Also, worn teeth, like what I said earlier, like you grind your teeth, they start to become a little bit shorter and then a little bit more shorter, and then you're smiling and you cannot see teeth. I have had patients who are like, I smile and nobody can see my teeth. And I've had actually a grandparent who came to me and was like, my grandkids, they told me I have no teeth. I need you to make my teeth a little longer. And we did. So basically, with years and years of grinding the teeth very hard, they become short. And as I said, when they are shorter and your smile, especially if you have a low lip line, like basically your lip is a little bit longer, you keep smiling hard, but nothing is showing. So what do we do about this? We make the teeth a little bit longer. And how is that? I'll tell you later. But it can be fixed, obviously, and you just, if you can do yourself a favor and get yourself a little night guard if you grind your teeth, that would be amazing. And it can help you from over grinding your teeth or basically wearing them off. Also, acid erosion can do that too. Or if you have acid reflux, it can cause your teeth to kind of lose their enamel. And once the enamel is gone, then the teeth starts to become a little shorter. Your enamel is basically 2 to 2.5 millimeter thick on the biting surface. That's a lot. 2 to 2. That's a lot. You know, when you're smiling, you only need, like, you know, when you are like basically at rest, you want to see like around 1 to 2 millimeter of your teeth showing if you are not smiling. If you're smiling, of course, you want to see the full teeth. Okay, so we spoke about discoloration and yellowing and worn out dentition, or basically like completely worn out from grinding or from even clenching or from acid erosion. And gummy smile too. If you have an uneven gum, so gummy smile, it means when you are smiling, you see a lot of gum, like a little bit short teeth, but a lot of gums. And how we can fix that? So it can be done if it's just a little bit of gummy smile. Sometimes we can recontour it using laser, but if it's a lot, then we might have to do a little surgery to fix that. But I'll tell you a little trick for everybody listening to me here. Sometimes if you have like a short lip, like the lip is short, if you get a couple of Botox injections here, it can make the lip, when you smile big, it doesn't go all the way up. So you still have a gummy smile, but it's not showing as much because your lip cannot move much, if that makes sense. You know, sometimes people smile and your lip is like up to the nose here. Okay, but if a couple of Botox injection can basically, even if you smile hard, it just kind of lift the lip a little bit, not much. So that can be something to consider. If not, then we can always do something, you know, with the gums, basically cut the gum a little bit, whether we do it with laser, if it's just a little bit that we need to fix, or if you have an uneven smile, like one tooth looks longer than the other, we can fix that by recontouring the gums and basically make them look a lot nicer. If it's in the bone, so sometimes it has to be also done with the bones too. Sometimes we have to, okay, if you're telling me, how are you gonna remove bone and my teeth are gonna look? Remember when I said the teeth are short? So what do? We need to make the teeth longer now. And how do we do that? Sometimes, okay, if that's the tooth and there is a lot of gum on the top, so we can cut the gum from the top and put veneers or crowns to make the tooth a little bit longer without increasing the incisal edge. Okay, this is very important now. So if the tooth is short and we want to make it long, I'm going to repeat myself now. We just kind of recontour on the top here. So if we have to remove a little bit of bone from the top and basically recontour, of course not a lot of bone, because you also want to make sure the teeth, they stay in place properly, a little bit, and then, you know, recontour it. And then at this point we have to put a veneer or a crown to cover this. Now, if there's no gummy smile, but the teeth are short from years and years and years, and you are smiling and nothing is showing, then we increase the length of the tooth from the bottom. But if this is the case, we cannot just do one tooth, because then you're gonna we have to do pretty much all the top teeth. We call it a full mouth rehabilitation. So we have to increase the length of the teeth together the same time. Okay, are we good on here? So we spoke about the discoloration, we spoke about the worn short teeth, we spoke about the gummy smile. And what else? Also, if you have missing teeth. So let's say years ago, you pulled a couple of molars from this side, a couple of molars from this side. So what happened? Your cheeks, they start to sink in. You're talking and they are sinking in. And when that happened, you look at yourself and it's like, you remember when I said at the beginning, you want to see like a plumber, like your face is basically more plump, more basically full. you cannot have that if you have teeth in the back that they're like gone. So what do? We need to put teeth from the inside to push and support your lips and your cheeks from the inside. How do we do that? Well, magic, okay? But really, let's say you have a lot of missing teeth, you can get denture or a partial denture, or you can get implants, or sometimes if you have all your teeth but you have a collapsed bite, which means all your teeth are kind of going in, you know, if you smile big, like you see my smile, I smile big, you can see all my teeth. But the teeth in the back, sometimes they are basically inclined more towards the inside. So the best line to approach that is really to fix them, to kind of push them out again, rather than like this. We have to put them in, you know, more upright position, and that can give your cheeks and your lips from the inside more support. Or if this is not enough, because the teeth are a little narrow, sometimes we put porcelain veneers on those teeth to give you that fuller smile. So you're smiling. All those famous actors, actresses, all of them, they have that. So basically, unless if they have like amazing teeth, so some of them they do, but basically just to kind of push the lip and the cheeks from the inside, so when you are smiling you can see teeth, not just, you know, few teeth in the front, but also you see like a fuller smile. Okay. And sometimes if you have like one chipped tooth in the front, one tooth, and you are smiling, remember when I said about the frame, like the frame looks off because we have one tooth that looks, you know, crooked, or something is broken there or chipped, and all it takes is to fix that one tooth. Or the color is off, or you had a root canal in the tooth, you never got a crown, so the tooth looks darker than the rest of your teeth, and you're smiling big in your picture and it shows. And a lot of patients, when they have this, they don't want to even smile at all. And I'm like, you know, we can fix that, and it can be fixed. It's very easy. We do it on the same day because we have the technology. So a lot of times if I have a front tooth that's, you know, chipped or broken, and we keep putting bondings and it keeps coming off because there is a lot of forces coming on it, so we end up putting like a veneer. And how do I do it? How do I give that symmetry back? I basically scan your teeth, and the other tooth, I make a copy and I flip it over, and then we have the same exact tooth, same symmetry on the other side. Looks very nice, very natural, because we do porcelain, we don't do metal at all. So this is, you know, an option. Okay. Or if you want to have like a crown, I mean, it all depends on how bad you know the chip is, or the fractured part is. And of course, if you have crooked teeth, if your teeth are misaligned and it's like one on top of the other, and you're smiling and it's like, okay, they're all on top of each other. And the thing is, really, with braces or orthodontic treatment, I need to make sure you guys understand this is not cosmetic, this is functional. Because when your teeth are basically on top of each other, you're not biting properly. Your teeth, when you are born, your teeth are supposed to chew in a certain way, not like this, but they are basically supposed to be hitting each other in a certain way, just like this, not like this. This is edge to edge. Okay, this is supposed to be like this, so that when you are also chewing side to side, they don't interfere, if that makes sense. And don't talk to me about insurance now, because insurance will say whatever they want to say, and it depends on the plan. So what I'm trying to tell you, insurance should not basically control how your treatment has to be done. I understand it's a big part, but a lot of patients, their plan doesn't allow you to have an orthodontic treatment done at a certain age. So maybe when you, and this is very important, when you guys are getting dental insurance, you always have to ask questions, important questions. If there is there like an age limit, is there a missing tooth clause? What does that mean? So a lot of patients, they come and like, oh yeah, I have orthodontic treatment approved, and I'm like, yes, but you're not 19 anymore. And he was like, what? So they put like the fine prints. They say, okay, you can get orthodontic treatment until age 19 or age 21, but you are 40 something now, you can still get your treatment done, but that particular plan is not going to cover it. So always make sure that, especially if you work with an employer, ask, you know, try to get all the information before you sign up for that particular plan. Okay, very important, guys. And what else? Basically, old fillings or metal crowns. Remember when I said, you know, we don't do metal anymore, silver fillings anymore? And why is that? Because over a period of time, silver fillings, they creep. What does that mean? They lose shape. So if you have like a very big silver filling, it starts to lose shape on the side, and it can cause recurrent decay around the margins. And not only that, but the tooth itself, unfortunately, start to become darker. The actual tooth becomes darker because of the, you know, all the alloy material getting infiltrated in the dentinal tubules. So we don't use silver fillings anymore. We are using white composite fillings from now on. And why is that? Because they have certain, they can flex. They have certain not elasticity, but they flex with the tooth. The silver fillings, they don't. And with time, with the silver fillings, if you have a big silver filling in your mouth, go check yourself in the mirror. You're gonna see like a million crack lines around it. Very thin crack lines. And unfortunately, with time and age, and you're biting, you love eating nuts, and you bite, and you're gonna come and you be like, my tooth just cracked and I don't know why. I was eating a sandwich, or I was eating like yogurt, but that happens over time. So silver fillings at this point, if they're starting to open up or lose shape, you need to have them replaced. Okay, especially if they are between the teeth and they lose shape. So this is basically, it acts like a little step, a nest where the bacteria sit there, and then you start to get food impaction, bleeding, and then the bone starts to go away, and it's a mess. Okay, so all silver fillings, if your dentist tells you, okay, it's time to get them replaced, please do so, have them replaced. Also, metal crowns, you know, we used to do a lot of porcelain fused to metal in the front. What does that mean, porcelain? So we had different types of crowns. So in the back, we used to put silver crowns or gold crowns. Gold crowns are standard in the back, in the posterior area, but not in the front. So we used to put porcelain fused to metal. So that's a metal, like metal, and then they put porcelain on top of it. Now the problem is, especially if it's in the front here, you start to smile and you start to see like a dark line. And it's like, what is this? What is that grayish line around? It's because the gum is receding and that metal is starting to show now around that area. So how do we get rid of this now? We have a lot of very nice material now, which is full porcelain, very strong material, and we just replace the crown with the new material. So even if your gum starts to shrink a little bit, you're not gonna see it because that's porcelain. There is no black metal in it. So you smile and nothing is showing. Okay, so we spoke about few things today, which is when your face, you know, start to look a little bit off, or basically your smile to, you know, is starting to change. And I've had so many patients. I had a lovely patient, she's like 93 now, came to me like, but she is very like, you know, she's very sophisticated. So she came to me like 20 years ago, and she's like, my front teeth, they don't look the same as I was like 20 years old. She's gorgeous, she's beautiful. And I said, let me see. She says, you brought me a picture. And I said, well, you know, they're exactly what we talked about. They're getting thinner, they're getting shorter, and they're getting darker. And when they are getting thinner too, so they look darker. So what did we do? We did veneers, and she was basically super happy because right now her smile looks exactly like what she was when she was 30 years old. However, I told her I don't want to make them too white, so it doesn't, you know, it's gonna look like really off. So we made them, you know, like maybe 3 shades lighter than her teeth, which she was very happy. Now, how can we fix that? Okay, I give you all the wrong all the like the problems right now, but how can I restore, how can I rejuvenate my smile again? Well, easy, very easy. First, get some whitening done. So of course there are different types of whitening out there in the market. Make sure you consult with your dentist first. And why is that? Because if you have fillings or crowns in the front, they will never get whiter. You're going to end up with white teeth on the side, but not the front ones. So you have to make sure you consult with your dentist first. Now, there is the professional whitening that's done in the office versus the one that you can buy, or the one that you can get like custom trays with the gel and you do it yourself. Of course, the one that really works like really well is the in-office, the one that you sit in the chair for like an hour or an hour and 15 minutes and you leave with really white teeth. But that's one option and it works. I've had patients, they're like, my teeth are gray, they will never get white. I said, well, let's try it. And they couldn't believe it because their teeth, they became white. Of course, we're not talking bleaching white, but they went like, 4 shades lighter, which is amazing. It's a big transformation. So whitening is a good option. Number 2, if you have those little shorter teeth, worn out, remember I talked about full mouth rehabilitation. We might have to crown them all, or we might have to put like some veneers, some porcelain veneers. Composite veneers can be done also, but with time and age they can get discolored, because porcelain is very different than composite. Composite can absorb the stains, porcelain doesn't. Okay, make sure you understand that part. And what else? When you have the uneven gum, we spoke about how we can reshape the gum. And in my office we use laser, so there is no bleeding, no pain afterwards, because there is no bleeding at all. We just literally numb you and we just kind of recontour it with a little tiny laser tip, and it's good to go. It looks a little ugly the first week, and after that you just like it never happened. Okay, and after that the crooked teeth, fix them with aligners. Stay away from metal braces. I've had metal braces for 3 years. It was agony. And yeah, and then I didn't wear my retainer. I'm telling you my personal story now. And then my teeth shifted and I went back and I got aligners. Best decision ever. My teeth are nice now, and I wear my retainers at night every single night. Cannot sleep without it. But this is not only for younger, like teens. It's for everybody. I have patients who are like over 60 years old, 68 years old, getting braces. I've had patients who are 13 years old getting, not braces, getting aligners, and the 68 wearing aligners now, and it works, and they're very excited because, as I said, this is not really cosmetic. You are basically protecting your bite. You're protecting your teeth. You want to keep your natural teeth for as long as possible. Okay? And then, of course, if you have a little bit of, missing teeth here or there, you have to put something there, because otherwise your bite is gonna collapse even more. Your whole face is gonna collapse. Your cheeks are gonna sink in, and this is when you start to see more wrinkles. Okay? And finally, digital smile design. Okay, this is what we do. This is what I love doing in my office all day long. Digital smile design. So you come and we basically scan you, and we can basically tell you, okay, this is how the teeth are gonna look like, and you look at yourself like, oh my god. All right, I hope you enjoyed this episode. Don't forget to share, like, and subscribe to our channel in order to get to know more about your teeth and your oral health, and to share it with your friends as well. And don't forget, take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.